Now, it looks like it is the start of the summer. Thankfully, the weather has improved. For most of us, I know in Scotland it's been a bit grim, and Glasgow's grim this morning, I know, but most of us are going to be enjoying the sun this bank holiday weekend. But of course, that means there are dangers we need to be aware of once again. So let's talk to Alison Jobbins, who noticed a mole on her leg had changed shape, was diagnosed with melanoma after getting it checked, and consultant dermatologist Dr. Shah was the doctor who told her to get it checked out. Morning to you both.
Morning.
I mean, this is a familiar story, isn't it? And every year we're so terrible for just getting out there and trying to soak up the sun. Were you a particular sun worshipper, Alison?
No, not at all. I'm relatively fair, so no, not at all. Obviously, I'm fair. I have freckles and I have moles, so you know, should be someone that should be checking these things more regularly.
So, what made you take notice of this one particularly?
It had changed shape. It had become darker. It was almost Treasure Island in shape. So all of the things that you're told to look out for. And I'd noticed it a couple of weeks before I went to Latitude, the festival last year, and the British Association of Dermatologists had a pop-up stand there, which is where I met Dr. Shah. It was him that told me that I should take this very seriously and go and be seen.
So you get to give advice and go to festivals, Dev. That's not a bad job, is it?
Absolutely.
I mean, how easy is it for someone in your position to spot that something is at least of concern?
It's usually quite easy, and we have certain guidelines and certain structures that we look for, and really taking into account patients' history as well as looking and examining thoroughly, we are able to spot worrying signs very early on.
And do what? Because what people want to know is, if you've got a melanoma, you know, is it benign or not, and, you know, and what are the chances of catching something in time?
Well, we generally, if we think something is worrying, we will obtain a biopsy and we will remove it and look down a microscope and confirm the diagnosis early on. Prior to doing that, we would look with a specialised magnifying glass called a dermatoscope, which is what we used at the festival. And it's usually pretty obvious to us whether something is worrying and needs to be removed. And remember, if we remove these sorts of tumours early, then we can cure them. If we leave them late, then it's very difficult to cure them.
And can you just clear something up? Is it a fallacy that people with darker skins don't need to protect themselves as much? Is that simply not true?
Well, people with darker skins are at less risk of developing melanoma skin and non-melanoma skin cancers, but they do have a risk of a background risk of having any type of skin cancer. And with very dark skins, it's particularly on the hands and on the nails and that people develop skin cancers. So beware, everyone should be examining their skin, whether you're fair or whether you're dark, and get to know your body and your skin.
There is a danger, isn't there, when I mean, thankfully, Alison, in your case, you know, this was spotted, you got it checked out and everything's fine, but there is always an issue, isn't there? As soon as the sun comes out in this country, we do just take our clothes off and lie in the sun until we turn into lobsters.
Absolutely. I mean, the message that we're trying to get across from the British Association of Dermatologists and the Sun Awareness campaign, which has started this week, is that we want you to enjoy the sun appropriately and go outside, but use it sensibly, and use a sunblock regularly, and be outdoors, but avoid burning, avoid tanning, because that is just a sign that you're damaging your skin.
Sensible advice. Dev Shah, thank you. And Alison, thanks for sharing your stories, but I'm glad everything has worked out okay. Well spotted in time.
Thank you very much.
Thank you.